Victory Spinal Care.
Hey everyone, we're here with Trisha. Trisha, if you don't mind for the camera, would you introduce yourself and tell us where you're from?
I'm Trisha Whitaker and I live in Cape Girardeau.
Yes, very good. So Trisha and I met a bit back, and over time she's really learned a lot about upper cervical care, and we'll get into all those details in a moment. But initially, Trisha, how did you first come in? What was going on with your health that brought you in to get care?
Well, I came in first because I had my first child and I had a lot of tailbone pain. So after he was almost a year old and I was still having a lot of pain, and it was hard to sit for long periods of time, and I would just have a lot of soreness. So that's what brought me in initially.
Right. So we started doing some adjustments, and it took a bit of time with your situation. Tailbone has been kind of chronic, but over some time, tailbone started doing better and better.
Mm-hmm.
And so what were you seeing with the tailbone throughout time with adjusting and making changes in your health?
I mean, over time, I think going into my second pregnancy, I was nervous that I would have a lot more tailbone pain, but I really didn't. And I'm on my fourth pregnancy now, and I haven't had any issues, just with maintaining care.
Right. Yeah. So the tailbone totally resolved at some point. Then you were talking with me before the camera was on, and you said you didn't even recognize really what upper cervical is all about, and what different things that may help with your health. There's another thing with your health that changed. What was that thing?
Well, I didn't even realize it because, when you have kind of chronic pain, you don't really realize it.
Right.
But I started noticing that I didn't have headaches, and I just never remember not having a headache. I just had one pretty much every day.
Right.
And now I always know when I need to come and get adjusted because I'll get a headache.
Right. Okay. Yeah, exactly. So we have a lot of people that will come in, they say, hey, I didn't realize how bad I felt, and I thought it was normal to have headaches day to day, but when we start getting the body to work correctly, those things should obviously go away.
Right.
So because of all the things that happened to you, eventually you brought your husband in, your kids have all been in, and again, before the camera was on, we talked about some things with your kids' health that's really a rarity in our society today. So your kids are what ages again?
7, 5, 2.5, and not yet born.
Right. So with the 3 kids and 1 on the way, since kids have been getting adjusted, and you of course take good care of the health, you feed them right and do good things for their health, but since getting adjusted, all these things you're doing, they've not had something that almost every other kids have at this point. So what have they never been on before?
I've never had antibiotics
Right.
or really any over the counter or anything.
Not Tylenols, things like that.
Nope.
Yeah, so that's one of the things we see a lot. When we start doing upper cervical care with children, a lot of people think of what we do as a neck pain, back pain, headache thing. We do want people to feel better with those things, but we really are about how to have optimized health. We want the immune system to work well. So when children's immune system is working well, their body should be able to fight an infection and deal with it. And so this upper cervical thing really makes a big difference with kids' health, adults' health, and health all around. Is there anything else you want to add about the clinic or things about going on over here?
No, I mean, we're just so thankful, and our whole family loves coming and enjoys it, so thank you so much.
Well, we love having you guys, and thanks for your time today.
All right, thanks.